Hi, my name is Colin Mudrick, and I'm one of the joint replacement surgeons here at Bon Secours. So when pain has started to affect your daily life, and whether that be playing with your kids or grandkids, doing things you love, or even sleeping, I think that may be time to start to consider hip surgery. The beauty of the anterior approach is that the hip actually lives in the front of the body. So in surgery, when you're approaching the hip, there's very little muscle that you have to go through to approach the hip, as opposed to other approaches where you're cutting through at least 3 or 4 muscles to get to the hip joint itself. Because the incisions on the front of the body, our concern for dislocation is less. Because of this allows us to allow patients to do whatever they would like to post-operatively and do not have the normal restrictions that you have with other approaches to the hip. With the combination of the anterior approach and the medications we use this day and age, we have drastically reduced our time in the hospital, and there are patients that have even undergone this surgery and been able to go home the same day. So when we perform the anterior approach, the patient is lying on their back. The benefit for us as surgeons is that we can use an X-ray machine in the operating room that allows us to recreate the anatomy of the patient and try to have their side match their other non-operative side and give them the best outcomes that we can give them. Hip replacement surgery is one of the most successful operations we do as orthopedic surgeons. And I think with a minimally invasive approach and our better understanding of how to control and treat pain, we have been able to improve on an already fantastic operation.